what surprised you about med school when you started?
Medical school wouldn't be too hard for some reason. I thought, like last year, there was a big jump for me from high school to university. And I was like, this is pretty hard. The competition's pretty hard here. And then mid school was even harder. And I was like, it's understandable that you can see all those YouTubers like crying. It's like it's not easy for sure.
I'm Shanna, a Canadian medical student. Every Wednesday and Friday, I release interviews with different med students and physicians, advice videos, and videos based on viewer comments. Subscribe to not miss a chance to learn how to be the most productive and stress-free med student or applicant you can be. Let's thrive, not just survive in medicine together.
What are you still struggling with in med school right now?
Trying to cope with content and balancing things outside mid school with mid school.
I really think that was definitely a struggle when I was first starting med school, because I felt like I can't take a single break, otherwise I'll fall behind or be not learn that thing and then be stupid or something. The first one. So content, I think maybe this might help you, but I used to think like whenever I learned it, I don't understand, like I would get upset that I would forget it in a bit, maybe like in a couple months, like when the test comes, you're like, I know we learned this, it's so familiar, and I would get like so mad because I was like, oh, I've studied so hard. But when I talked to one of our deans, her advice was that like there's a reason why we go to med school for 6 years or 4 years, because like there is a lot of content to learn, and if it was really easy, we would only have to go to school for like 1 year, right? But no, like there's a reason why it's so many years, because we need to learn it. And then because I was putting a lot of pressure on myself to know it the first time, her tip was like that like the essence is really repetition. So she's like, the reason that she knows all her stuff like really well, and I used to feel really intimidated by the doctors that would come and teach us, that they like knew like the mechanism of every antibiotic. For some reason it was like super detailed, and they would know exactly what dose, and I was like, how do you remember that? Because sometimes I don't even remember which antibiotic to use, right? But I think she was talking about how it's just like repetition. Like when you've been doing it for 10 years or something, you just see it every day, you see it every week, and you just see it so many times that it will come back and come back. So it's okay that, say, something you learned now, you'll forget in 4 months. You switch to, and you forgot all about GI because now you're on neuro or whatever, or psychiatry. But that's okay, because once you go back on rotations, you'll remember it. And then when you see, a psych patient and the next time, then you'll start remembering the more times you see it. So in terms of content, it's not something that you can really know all at once and supercharge it in your brain. It's kind of what we're doing right now in the first few years is, distilling all that information and then building like a good knowledge base. So, if you know most of the basics of MSK, then later on when you see things you'll be able to like relearn it faster. So even if you forget it, the process of relearning gets easier and easier, and then the more and more you see it, it will help. And then also in terms of content, I think I would get a bit lost in the weeds in the first year, so I would like learn all the very specific details. So say like the criteria for diagnosing I can't think of MSK disease, but GI disease, like how to diagnose Crohn's disease or something. I would think I need to memorize the entire like 9 criteria and then the lab value, and then obviously I couldn't do that, but I was trying to memorize all of that, and then I realized that instead now, like for the test, I think you gotta know all of it, but now in terms of just like trying to be useful and like more manageable instead of like being overwhelmed by the content, I just think like what are the keywords that if I saw a patient that I would think about it. So like, bloody diarrhea, abdominal pain. And then also in terms of mechanism too, like it'd be hard to, memorize exactly, TNF alpha and like IL whatever. Well, I guess I do know it, but, but, in terms of like just knowing vaguely that it's, kind of related to an immune mediated thing. And then just like recognizing the most common and most key things I found was like helpful in terms of like keeping it manageable. Maybe is that really obvious?
No, that's good. Is
that kind of what you meant by like the being overwhelmed by the content?
Yeah, definitely. I guess it's really important to learn the like trunks of the tree before the leaves. Like we always taught details, and then it's so easy to get caught up on details but ideally we should be memorizing key concepts first and then adding stuff on, which is what you said.
Yeah, I think that's a good idea. I think I would say that that's not totally a med student's fault. I think it's because we sometimes invite a specialist to give us a lecture, and so they kind of don't teach us like the more basic general like branches, but they kind of go right into the leaves and tell us all this stuff. So sometimes we have to be able to step back. Another internist gave this advice that she thinks it's like as a med student, a really good tip is to just when you're like stepping back and you're feeling really overwhelmed about learning like details of something particular, realize that as a med student or just probably in even when we're in residency or as an intern, the most important thing instead of knowing the disease and everything about it is just knowing the approach. So breaking it down in terms of approach to like abdominal pain. What are all the different, general things that you should look for? What are the most common? And then what are the rare things? But just knowing if someone says, the patient's coming in to emerge with abdominal pain, what are you going to do? Or the patient's coming in with knee pain. What are the general things that you should know? And thinking in terms of like knee pain, nausea, chest pain, in terms of big, broad approaches in patient presentations. That was another way that I thought was more manageable. Kind of remembering these like big ideas too. And then something that I need to do now that we have time to do it, that some of the upper years say is that they like when they're distilling their notes is they're just pulling out the like most critical things. So like, I guess like, if you're re-summarizing your digestive notes or stuff like that, just really only pulling out like the key things. And then that's like supposed to be helpful. I haven't done that myself, but I'm passing that along. Yeah, balance. Yeah, I don't know. Is there any ways that you've been getting better at balance?
Not really, to be honest. It's something I've been working on. Do you have any tips, Shauna?
Oh, man, I feel like I am terrible in terms of like I tend to like overdo to like work too much. So
Oh,
that's probably a reverse problem for some people. Yeah, I'm trying to work on it. For example, now that I'm trying to start up YouTube, I feel like that's something I'm trying to relearn that balance because like for me, if I get into a project, I just want to make that like because once I have like come up with more ideas, I just want to keep spending more and more time on that. So now I'm trying to set like limits. A tip that I think I picked up from a friend is like designate a particular time or like a schedule that these other things have to get done. Um, is like kind of useful. And then I think one thing that I'm trying to do is actually set limits on how much studying I do, which is kind of interesting because before when I was earlier in high school or something, all I want to do is just like maximize the amount of time to study. So I would try to think, how can I make everything else efficient so that I have more time to study? But now I'm thinking like, actually, it'd be better if I don't just study endlessly and I need to like know like this is the time to like shut off. And I think that's really hard for me because I feel like sometimes I'll feel guilty if I'm not studying. But what was really helpful the other day, we were studying for an exam with a friend, and so she was like, "Okay, what's our cutoff time? Say our cutoff time is going to be at 7:00. We're not going to study. So then we know that we have to like get everything done, and even if we feel guilty after 7:00, like try not to like fall to that guilt because you've already had a productive day that you need that play to recharge. I think it's in Brene Brown's book. She cites like some other book about play, and she talked about how like it doesn't feel productive to rest or to play, but actually doing that helps us be more creative. It helps us think more critically, stuff like that. Where I also sometimes I thought about that too. Like for example, like if I'm hanging out with friends or something, it doesn't feel like I'm learning medicine, but then I realize stuff like if you're listening to a friend who's going through a difficult time, that's actually helping me in terms of soft skills for medicine. Like, maybe learning that, that piece of their life that I'll never experience in my life, it will help me understand a patient, or just like, learning how to communicate better and stuff. So realizing that that time that is rest is actually productive too, is trying to help me stay more balanced.
having the mindset that it's okay to take a break. It's okay to just relax because in med school we're always just thrown like so much content's thrown at us that we always want to do the best we can. We're probably perfectionists and we're always caught up in this endless cycle of study that we forget to have a break sometimes. So I think acknowledging that it's actually okay to take a break, I think that really helped me.
Sometimes students are asking me is like, how do you stay focused and like, stay motivated to study for, a few hours and every week?
That's a good question. I think you should answer that question, Shana.
I'm actually making a video about how I felt like last week I kind of hit slumps, and so I think it's super normal to hit slumps for sure. Like for me, I usually hit a slump when it's like something I just don't find that interesting. So like some stuff, like I have to say I'm not a huge fan of anatomy, unfortunately. As much as I was hoping I would love it, for me, memorizing like like I like to know how things work. So I like physiology and stuff. But then when it comes to anatomy and then the microanatomy of like each nerve, each artery, especially all the muscles of the forearm and stuff, and I'm like, do not want to know this. I do not see how this is clinically relevant. So I think for me, because like, the whole choosing medicine and what I like the most, I think is thinking about how it can help people and thinking about patients. So I try to see if I can connect it back to a patient. And I think for me, I like when I connect it, even though we don't really need to learn all the diseases yet, and that's maybe more for later, I find that if I connect it to a disease more, that sticks to me. And so that helps me stick and like learn it better, but also it helps me stay a little bit more motivated, because if I'm only looking at like histology or something and I'm like, why do I need to know this? But then if I'm like, oh, like, yeah, I need to know what the normal looks like to know what squamous cell carcinoma looks like so that, we diagnose it properly. Something that helps a little bit. Other motivation, I don't know. Sometimes I honestly watch YouTube of like people who are a little higher up. Some reason that really helps me, or just watching people being productive, which is kind of ironic, I want to say. Like you're trying to become more productive by procrastinating, watching people be more productive, but somehow it works. What else? I'll keep thinking. But do you have anything while I'm still letting my brain think about how to be motivated?
Well, I definitely agree with trying to relate content that you learn to things that are clinically relevant, because like if you just learn something for the sake of learning something, as you said, it's a bit like, what's the point? So I guess I try to trick myself into having the mindset that even if this is not clinically relevant, I need this to have the acumen that I want when I'm a doctor. So maybe this won't directly be useful as a physician, but indirectly it might, to have that, that subconscious thinking, I guess.
When I was in uni trying to go to medical school, I was like, I keep thinking like, this really sucks, or I really don't want to study, but I do it because I really want to go to medical school, or I really want to become a doctor. So, you know what, it sucks, but let's just grind it out. So that was like one way to like stay motivated. I think trying to do stuff that's like outside of medicine actually is really helpful. I think that's a really nice one. For example, like for us doing stuff like YouTube, I feel like that's really nice to actually do something totally different. It keeps you sane, I feel like. Or for me, I feel like when I do some of the med school, like more mentorship style stuff, I feel like that motivates me, because then I think about like, oh yeah, like this is, I'm doing this because I want to help people, but it also reminds me I'm here at a place that I had really wanted to be at, and to remember to stay grateful for that.
That's really good. Like mentoring people helps you a lot, I realized. I was reading this book, Ego is the Enemy by Ryan Holiday, and he said that you need a person above you that can teach you the way, a person like just below your level that you can teach, and a competitor that you can challenge with in order to keep improving. And I was like, that's pretty smart.
That is really solid, actually. I could think of the times that I felt like maybe I didn't feel as motivated, maybe I didn't feel like there was competition, and I was starting to feel like there wasn't someone to look up to. So yeah, I think that's really handy. And that was his whole principle of like efficiency. Because before, I think I would just be like, the more hours I study, the better this is going to be, and just kind of like dumping time in, or like the more I felt like I was doing effort. So like if I was rewriting this a million times, like I felt like I was like, oh wow, I'm studying so well, but that doesn't really, sometimes it helps, but sometimes it doesn't. Did your study habits change?
In high school, I used to make flashcards by hand, like writing them. And we used to have such a big dick. But in med school, I guess you have to use Anki.
Yeah, I also love Anki. It's just, Yeah, it's just so much faster. I think one thing I stopped doing is I used to really like handwriting my notes. And as much as that, I think I still do that a little bit, like when I'm reviewing and stuff. But definitely there's no time to be like revising notes and reorganizing outlines all the time because there's just so much content. I feel like I learned to change that focus instead of just like instead of knowledge gathering, like more recall and stuff.
I bought an iPad, and I think that helps a lot.
Mm.
You don't need it for sure. Like pen and paper works fine. It's just that it's really useful to like annotate on the slides. If you were to just annotate like a diagram that a lecturer draws is just super helpful. And if you want to search something up, you can just scan through your handwriting. Like they have some system, some AI that allows you to like equivalent of Control F on your keyboard for your notes.
Mhm.
So I find that pretty helpful.
Ooh, is there a particular
But if
app you need for that? For them to
oh yeah,
start writing?
I use Notability, which is pretty helpful. Try to be efficient now because efficiency is really important. I value efficiency a lot because then it allows you to have more time doing other stuff that improves your well-being, which does help your studying. So I do value efficiency a lot more than I did at high school.
Thanks so much for watching. Hit the likes button and subscribe if you want to see more videos every Wednesday and Friday. This has been Shanna. Let's thrive, not just survive med school together. Bye! Thank you to TheONGWay for volunteering his time to talk to us.